Welcome to the overview of the 2024-25 federal budget, with a specific focus on nursing, midwifery, and Aboriginal and Torres Strait people's health, presented by the Congress of Aboriginal and Torres Strait Nurses and Midwives, or CATSINaM. I'd like to begin by acknowledging the sovereign First Nations peoples of the lands and waterways of the Australian continent and surrounding islands. I pay my deepest respect to our respective elders, past and present, and acknowledge their legacy that we have the responsibility to honour and advance. The legacy that CATSINaM honours and advances is to transform the nursing and midwifery professions, and subsequently the health system, to be less harmful and more culturally safe for our mob. We can achieve this through unity and strength through caring. On May 14, 2024, the Albanese Labour Government announced the federal budget for 2024-25. This budget includes several key measures aimed at supporting and advancing the nursing and midwifery workforce. This is CATSINaM's budget breakdown. Key investments include the $427.4 million allocated over 4 years for the Commonwealth PRAC Payment Program. This program will provide financial support to nursing and midwifery students during their mandatory clinical placements, offering $319.50 per week to eligible students. Along with other nursing and midwifery bodies, CATSINaM has long argued to address the profound problem of placement poverty, to help nursing and midwifery students complete their degrees. The budget also includes $5.2 million over 3 years to fund training opportunities for health professionals, including regional and remote practitioners, in the insertion and removal of long-acting reversible contraceptives. While not a new funding commitment, the government recently announced an impressive $50.2 million over 4 years for 1,850 primary care and midwifery postgraduate scholarships. These scholarships will enable health professionals, including nurses and midwives, to undertake further studies and advance their careers. The Australian College of Nurse Practitioners was announced as the organisation who won the tender to deliver these scholarships. CATSINaM has been in discussions with the Australian College of Nurse Practitioners regarding our support for this scholarship program, specifically to shape it to meet the needs of Aboriginal and Torres Strait nurses and midwives. Significant changes are coming to Medicare services, with $56.5 million dedicated to longer midwifery consultations before and after childbirth. From March 2025, new MBS items for extended antenatal and postnatal care will be introduced, ensuring more comprehensive support for mothers and babies. From March 2025, the budget also funds the introduction of 2 new general attendance items for nurse practitioners, including face-to-face and telehealth consultations of at least 60 minutes in duration. From 1 November 2024, the budget also ushers in transformative change, allowing nurse practitioners to request ultrasound services under Medicare to assist with the before and after care requirements of the MS 2-step medical abortion program. To further support midwives, the government will cover 100% of professional indemnity insurance claim costs for low-risk home births and intrapartum care outside of hospital within the context of birthing on country models. This initiative is crucial to enable the further development of birthing on country models. Investment in menopause treatment is also a highlight, with funding directed towards training health professionals. This will ensure more women receive the specialised care they need. Adding to a suite of existing aged care commitments, the budget includes $88.4 million to improve conditions for the aged care workforce. This includes growing the home care workforce in regional, rural and remote areas where workforce shortages are the most acute, and better supporting career pathways for nurses in aged care. There was continued focus on Aboriginal and Torres Strait people's health, building on previous commitments to close the gap in health outcomes and life expectancy of Aboriginal and Torres Strait peoples. A $4 billion partnership with the Northern Territory Government aims to improve remote housing conditions, addressing overcrowding and its impact on health. An additional $137.3 million is allocated to enhance health and aged care services, making medicines more affordable and aspiring to increase vaccination rates. Amongst other measures, free period products will also be provided in rural and remote Indigenous communities. CATSINaM remains committed to collaborating with Aboriginal and Torres Strait organisations, including the Coalition of Peaks, to ensure these initiatives support closing the gap in health outcomes.